They prevent a lot of diseases and things that we don't need coming back, and that they can keep kids safe and keep families safe. I think they're really important.
She's talking about vaccines, and most people would agree getting children vaccinated is essential in today's world. So why is it that fewer Minnesotans are choosing to get their kids vaccinated?
Yeah, no kidding. And a new report from Children's Hospitals and Clinics of Minnesota is actually showing our state taking huge steps backwards. I was just looking at the numbers here, and Scott Wasserman is joining us now. Scott, it's pretty amazing here. How much have we dropped, and why?
Yeah, we're dropping a pretty big deal here. It's 2 years ago, or in 2 years, Minnesota has dropped 13 spots from 7th place to 20th place when it comes to children 19 to 35 months of age getting the primary series of vaccines. And the percentages, they're pretty alarming. We're looking at these percentages right here, and they peaked back here in 2007 at 80.5%, and then 76.9% over there in 2009. Now you ask the question, why, Heidi? Well, the director of infectious diseases at Children's Hospital says complacency. People don't fear diseases like the measles anymore, and then misinformation, such as vaccines, cause autism. But in the last 2 years, the big one, the economy.
There are increasing numbers of people who have lost their job. If you lose your job, you lose your health insurance. You may have partial job that doesn't allow you to go on the Vaccine for Children's program that gives you free vaccines. So I think economic times, we know historically that people in poverty don't access health care. So those could be very well a part of this.
Yeah, and check out these numbers behind me. For every percentage drop in the immunization rate, more than 4,000 children from 0 to 5 years old are exposed to vaccines. Can you see these numbers behind me right here? 42,300 children, and they are exposed to preventable diseases. That's equivalent, get this, to 150 classrooms. But not everyone is on board. Sydney and Dorothy Morrill are 5 and 3 years old. They live here in Eden Prairie. Their parents are choosing not to vaccinate them and won't immunize the baby on their way. Their mother, Melissa, says they're just like everyone else. They've never missed a well visit and are concerned about their children getting sick, but are personally choosing not to get those shots.
I believe that the risks for an irreversible injury or chronic illness are higher than the risk of them actually contracting the disease and dying from it.
Now this is Hodan Hassan. She once felt the same way after her daughter Jenny was diagnosed with autism 4 years ago. After reading anti-vaccine articles, Hodan felt that she would hurt her children by continuing the vaccines. But a year ago, after a doctor encouraged her to think for herself, she found out more information, got more research, and now supports vaccines.
I used to call radio shows, used to send the emails, vaccines cause autism, and I didn't have any science behind that. It was just because someone else told me vaccines cause autism. I think vaccines are the greatest things that happen to mankind.
And you can see her change of view now. Hodan now feels so strongly about vaccines that she started Choose to Immunize, a nonprofit organization educating parents about the positives of vaccines. Back to you guys.
Yeah, and Scott, you and I both have little kids.
Yep.
And just recently gone through the immunization process. You know, there's a lot of doctors, most doctors in fact, out there who say this is absolutely all about the risk outweighing the benefit and vice versa. A matter of public health. So how do you decide? Well, one person was telling me, you know, if you're not thinking about yourself, think about the other children out there. There are children, of course, very young, 6 months and under, that cannot get the vaccines because they're too young. They rely on other children to be able to get those vaccines to protect them. If they're not vaccinated, they put the babies at risk. So doctors want you to think of that as well. Yeah, absolutely. All right, Scott Wasserman, thank you. Yeah.